Thank you for joining us this afternoon. Substance use disorder is a disease that is affecting our city. In years past, it was easy to think that the opioid crisis was happening in a different neighborhood or on a different street. That's no longer the case. I can assure you that substance use disorder is affecting people in your neighborhood and on your street. Many of our residents have died, and we have all suffered. We need to leave outdated stereotypes behind and move past the stigma as we move forward to address this issue. And so today, I am announcing the creation of a Mayoral Ad Hoc Committee on Substance Use and Recovery. The charge of this committee will be to conduct a comprehensive assessment of the challenges and opportunities for cooperation to address substance use in Lewiston. We will also work to develop a framework to support people in recovery. Councillor Stephanie Gelinas and I will co-chair this committee, and we are honored to have numerous members of the treatment and recovery community serve as committee members. Each of us is dedicated to working together to establish a recovery community here in Lewiston. I now invite Councillor Gelinas to say a few words. She will be followed by substance use councillor Chantel St. Laurent from Recovery Connections of Maine, followed by Chief Medical Officer Dr. John Alexander from Central Maine Medical Center, and then the Director of Opioid Response for the State of Maine, Gordon Smith.
Thank you, Mayor Shalene, and thank you for creating this Mayoral Ad Hoc Committee comprised of so many individuals who are ready to push up their sleeves and get to work on developing a comprehensive plan for addressing the disease of substance use disorder and recovery. While not one agency alone can tackle this crisis we have before us, our community is fortunate to have the resources we do: Tri-County Mental Health Services and Angels Wing, Recovery Connections of Maine, the Rest Center, Blue Sky Counseling, our hospitals, just to name a few. As a community of providers, we've pitched in together, and we've done some work to address an epidemic that has taken far too many lives. But we must do better, we can do better, and we will do better. I stand here before you today as a public official for the City of Lewiston and the chair of the Public Health Committee with a plea that we increase awareness, decrease the stigma, and most importantly, develop more resources for our community to address substance use disorder. Addiction is a complex mental health crisis and one that is wildly misunderstood. I truly believe that one of the most important goals for this committee will be to debunk the stigma attached to addiction for folks entrenched in this battle. We need to educate ourselves and others so that we can come to understand substance use disorder as a disease versus a choice. There is much to be taught and learned about recovery too. It's not always linear, and it's certainly not one size fits all. Rather, there are many different recovery pathways. I am eager to get to work and identify some solutions. It will take concerted effort and lots of coordination and collaboration, but I believe we have a host of people wanting to take this challenge on. We will not give up in our work to develop crisis stabilization, detoxification, treatment options, sober living, and a recovery-ready community. Thank you.
Good afternoon. My name is Chantel St. Laurent, and I am a person in long-term recovery. I am also a mother, a daughter, a grad student, and a substance use counselor at Recovery Connections of Maine, a friend, and a valuable community member. My story is not so different from many others in the recovery community. Substance use was my solution and a way to find relief from the pain and trauma I experienced. I used to believe I was a lost cause. I had used despite any and all consequences I faced. I used while I was pregnant, I stole from my family, I lost my housing, and at the end of my use, I was miserable, exhausted, and hopeless. For years, I tried to find my way in recovery, attending multiple treatment programs and joining recovery support groups. There were many aspects that contributed to my recovery: God, support of my family, medication-assisted treatment, fellow recovery warriors, and eventually I was able to thread together some time. I'll be approaching 6 years on May 5th. Substance use is wildly misunderstood, and people who use are far too often stigmatized, or as a fellow recently stated, discriminated against. We are people first. This is not an opioid epidemic, this is a trauma epidemic. And if we are going to make progress, we must be trauma-informed and treat all people with unconditional positive regard, regardless of where they are in their recovery. We need to make changes as a community. We are in dire need to make changes. We need more resources for people in and seeking recovery. We need effective policies and procedures that hold organizations accountable so no one slips through the cracks. We need to stop focusing on what we can't do and focus on what we can do. We need to be willing to learn about substance use disorder and be ready to have conversations, starting at home and in our schools. I look forward to being a part of this committee to collaborate and ensure we develop the best system of support and resources for our recovery community. I'm eager to not only be a part of the conversation, but to take action and make change. We have lost far too many sons and daughters to substance use disorder. One is too many, and absolutely no one is a lost cause. Thank you.
Good afternoon. It is my great honor to speak in front of you today about this important initiative to identify and provide comprehensive, equitable, and dignified services for people affected by substance use. As a member of the Lewiston Public Health Committee, for the past 2 years, I have seen and heard a great many people come before us to share their stories of recovery. Stories about resources already provided in our community, the resources needed to be effective in helping the most people, and most profoundly, the resources not available. There are an incredible number of women and men in our community, many of whom behind me, who dedicate their careers and their lives to helping to break the cycle of addiction for those who are impacted by substance use. But it is not easy work. As a physician practicing in emergency departments for nearly 25 years, I've witnessed on too many occasions people who want to begin their recovery but can't because of a lack of housing, unemployment opportunities, access to health care, and of course, an absence of substance use recovery programs, even an absence of understanding of what it means to be affected by substance use. Over the past 2 years, the pandemic has taken away many of the life experiences we have all come to enjoy. Visiting with friends and loved ones, in-person education for our children, enjoying indoor entertainment and dining, even routine visits with healthcare providers, and the pandemic has done more than just take things away. It has also created and worsened a mental health and substance use crisis. I look forward to working with the mayor, Councilor Gelinas, and the talented women and men who have volunteered their time and effort to this ad hoc committee, as well as all of those members in our community who work tirelessly every day to make life for people affected by substance use better. Thank you.
Good afternoon. I'm Gordon Smith, the State's Director of Opioid Response in the Office of Governor Janet Mills. Governor Mills was once the district attorney in this county. She cares deeply about the city of Lewiston and deeply about the issue of substance use disorder and the epidemic of that we have seen get even worse during the pandemic. I want to congratulate the mayor for putting the ad hoc committee together. I'm thrilled that he's asked me to sit on it, and I'm thrilled to be able to serve with the amazing people that he has selected from this community. The state is supporting a number of initiatives in the city of Lewiston now to 2 syringe exchanges. We support the recovery center. We support some recovery residences. But there are gaps. There are gaps. And one of the tasks of the ad hoc committee is to see what those gaps are and to fill them with the resources that are available. So I look forward to the work. I grew up not too far from this area. We used to come here to shop in the 50s and 60s. I'm a senior, and my dad had a little store, in fact, on Main Street in Auburn, and those were wonderful trips to come to Lewiston for Christmas shopping and things. So I'm excited to be asked. We have a lot of resources here. You've got 2 wonderful hospitals. You've got a terrific mental health center at Tri-County, Recovery Connections of Maine, and you've got hundreds, if not thousands, of people in recovery who want to help, who want to recover, recovery coaches, and I just look forward to helping them fill the gaps that remain, and the thought of Lewiston, becoming a recovery-friendly community, recovery-ready community is a really exciting concept. So congratulations, Mayor Shalin, and to members of the ad hoc committee, and appreciate all of you being here today. Thank you.
I want to thank the committee members who spoke, and for all of the committee members who are able to be here today. I will now sign the mayoral order establishing the City of Lewiston's Mayoral Ad Hoc Committee on Substance Use and Recovery. Thank you for these pens, Dottie. I look forward to developing ongoing community and municipal support for people in recovery. Thank you so much for coming, and I thank all of the committee members for their service to our city. Thank you. Thank you. Thank you very much for coming, and have a great afternoon. Great question. We have established it for approximately 1 year. Through March 31st of 2023. And we will have regular updates before the council during that time period.
Are you hoping that it leads to council action at all? Are you hoping that there's going to be actionable things that the city could help with, or might that just come to town?
We will